I'm Dr. Michael Thomassen from Nebraska Equine, and I want to take a minute here this morning to talk to you about vaccinations. So vaccinations for our horses can be broken into two categories. They're called core vaccines or risk-based vaccines. The core vaccines are vaccines that every horse should receive, regardless of if they're by themselves or with a group of horses, or if they never travel or they're traveling all the time. And that core group of vaccines is sleeping sickness, so both Eastern and Western, tetanus, West Nile, and rabies. Then the risk-based vaccines, most of them are, the most commonly ones are respiratory in nature. So strangles, influenza, and rhino or herpes. So those are vaccines that we give to horses that are either in boarding facilities around a lot of other horses, are traveling a lot, and so they can be given to any horse, but most commonly are given to the ones that have the greatest risk. So as far as time of year, most of the vaccines that we give are in the spring. So spring shots, we commonly call them. That's going to be your core based, and they often will include, a 5-way may include rhino and flu all in one, or they can be given separately. And then, so time of year in Nebraska, we're going to be wanting to give these vaccines in March, April, May, so that we have a chance for the horse's immune system to respond and be prepared for things like mosquito season and stuff like that. And then anytime we vaccinate any horse, one of the things that we want everyone to keep in mind is that there is the potential that the individual horse may have a vaccine reaction. A vaccine reaction could be a stiff and sore neck, especially when you feel at the injection site. It could be depression, not wanting to eat, running a fever. All of these things are things to watch for, and if you see these following vaccination, it would be a good idea to call your veterinarian and talk with them and have your horse examined. Most of these are not very severe, however, it definitely warrants at least a conversation with your veterinarian. So hopefully you know a little bit more about what we vaccinate for, when we vaccinate, and the things to watch for following vaccination of your horse.